Welcome to UMCC Medical Consultant Connector, where your health matters to us. Have you ever paused to consider the silent enemy that is cervical cancer? It's an insidious foe, often lurking unnoticed until it's too late. This major health issue is a silent but deadly adversary, making it even more critical to arm ourselves with knowledge about its causes, symptoms, and prevention. In the battle against cervical cancer, information isn't just power, it's a lifesaver. It's about understanding, recognizing, and taking the necessary precautions. Knowledge and awareness are our first line of defense against this silent enemy. So what exactly triggers cervical cancer? A question that requires a multifaceted answer. The primary culprit is a persistent infection with certain types of the human papilloma virus, or HPV. It's a common virus that can be passed on during sexual contact. And while most HPV infections do not lead to cancer, some types are more likely to cause cervical cancer than others. Smoking is another risk factor, as it increases the risk of many types of cancer, including cervical cancer. A weakened immune system also plays a role, making it harder for the body to fight off the HPV infection. Other risk factors include having many sexual partners, long-term oral contraceptive use, and having a family history of cervical cancer. But remember, these factors only increase the risk. They do not guarantee the development of the disease. Every person is unique, and so is their body's response to these risks. Understanding these causes equips us with the information we need to make healthier choices. Now that we know the causes, what are the signs we should be on the lookout for? Well, early symptoms of cervical cancer can often be silent, but as the disease progresses, one might experience irregular bleeding, such as between periods after sexual intercourse or postmenopause. Other signs include unusual vaginal discharge, discomfort or pain during intercourse, and pelvic pain. Late-stage symptoms typically involve weight loss, fatigue, back pain, leg pain or swelling, and even leakage of urine or feces from the vagina. Please note that these symptoms can also be associated with other health conditions, so it's crucial not to jump to conclusions. However, they should never be ignored. If you're experiencing any of these symptoms, consult with a healthcare professional promptly. Regular screenings like Pap tests and HPV tests can detect cervical changes early, before they develop into cancer. Remember, early detection greatly increases the chances of successful treatment. So how can we shield ourselves from this silent enemy? Well, the good news is that prevention is within our power. The first line of defense against cervical cancer is the HPV vaccination. It's recommended for both boys and girls and can significantly cut down the risk of infection by the types of HPV most likely to cause cervical cancer. Next, regular Pap tests can play a crucial role in early detection. They help identify precancerous changes in the cervix that might develop into cancer if not treated appropriately. But prevention doesn't stop at medical intervention. Our lifestyle choices matter too. A diet rich in fruits and vegetables, regular exercise, and avoiding harmful substances like tobacco can all contribute to a healthier body and a stronger immune system. Remember, in the fight against cervical cancer, your actions can make a significant difference. With preventative measures, we can take control of our health and reduce the risk. But what if you or a loved one is diagnosed? Is there hope? Absolutely. We live in a time where medical advancements are continually evolving, and that's definitely something to be thankful for. When it comes to cervical cancer, there's a wide array of options at our disposal. Treatment plans are tailored to each individual because every person, every cancer is unique. Surgery is often the first line of defense. Doctors may remove the tumor or in some cases a part of the cervix or even the entire uterus. But rest assured, these are decisions made with the utmost care and consideration for the patient's health and future. Radiation therapy is another powerful tool. It uses high-energy rays to kill cancer cells, and it can be administered externally or internally. It's a bit like having an X-ray, but much more potent and specifically targeted. Chemotherapy, often used in conjunction with radiation therapy, uses drugs to kill cancer cells. These drugs can be taken orally or injected, and they work by disrupting the growth of cancer cells. And let's not forget the importance of regular checkups and follow-ups. These are critical to ensuring the treatment is working and to catch any potential recurrence early. Remember, early detection and appropriate treatment can make a significant difference. With the right care and support, cervical cancer can be managed effectively. In the face of cervical cancer, there is hope. Knowledge, awareness, and action are our weapons in this fight. UMCC, your ultimate medical consultant connectors. Kindly subscribe, like, and share.